Stark warning from former NHS psychologists over the services being offered to young people questioning their gender. Demand for gender services from under 18-year-olds is surging, and a record number are now being referred to the NHS's only gender service for children. Psychologists who have left the service have told Sky News they felt unable to properly assess children having medical treatment for gender dysphoria for fear of being branded transphobic. Sally Lockwood has this special report.
A growing number of young people are questioning their gender, and there's growing concern over the number wanting to change their bodies while they're still teenagers. For some, it's the right decision. This is Leo. He's 16 years old and was born female. He now identifies as male. Leo's very happy with the medical treatment he began at 14, but it still meant making big decisions at a young age, choosing if he wanted to freeze his eggs to preserve his fertility.
How did you answer that question?
Personally, my view of it is that I didn't want to because the process I thought would have been quite difficult. I would have struggled because I would have had to go on oestrogen, which is obviously not something I wanted for a month, and then there's the process of extracting the eggs and everything. And if I wanted kids in the future, which obviously I'm not certain about, but I could always adopt.
Things are going well for Leo, but Sky News research suggests 35 clinicians have resigned in the last 3 years from the London Gender Identity Development Service where he was treated. Sky News has contacted 20 of them. 6 psychologists told us they were concerned about giving hormone treatment to children with gender dysphoria. All 6 said they weren't able to properly explore underlying psychological factors. One said, "We fear that we have had front row seats to a medical scandal."
Looking back, there are young people who I now wouldn't necessarily put on medication or sign off on medication.
This was the only clinician prepared to be interviewed. They asked us to change their voice.
And as a psychologist, did you ever feel that you could say to a parent, "I don't believe your child is trans"?
No, and this is one of the reasons why I decided to leave the service, because as a psychologist, I felt that if I ever spoke to a family like this, I would immediately be called transphobic.
A record number of young people are now being referred to the Children's Gender Service at the Tavistock. There were just 77 patients referred here 10 years ago. By last year, the number had climbed to 2,590 children. And they've told us around 3,000 children are waiting to be seen.
We have a very long waiting list, which is really unfortunate and is absolutely not of our wish. It complicates everything about our engagement with these young people and the help we can offer them.
When we met Luke, he was one of those children on the waiting list. He's 17 years old and was born female, but he's been identifying as male since 14. He was referred to the Tavistock for treatment, but it's been a 2-year wait. In the meantime, he found a GP online who prescribed him testosterone. He's essentially changing his body himself.
So how much did the phone consultation cost you?
If I remember correctly, maybe like around £50. I think if you go for like the Skype call session, it's a bit more expensive. But every so often.
So they didn't see you in person?
No.
And they prescribed you testosterone?
Yes.
For many young people, gender is simply much more fluid. Children are being encouraged to express themselves outside of the binary male-female stereotypes. Much of the concern expressed to us isn't about whether people should transition or not. It's about the age at which they're medicalised.
The Tavistock say all their young patients are properly psychologically assessed. And in a statement, they said the Gender Identity Development Service supports every young person on a case-by-case basis as an individual. But there seems a crisis in the care available. A service overwhelmed with patients, some clinicians expressing concern over their treatment, and children making big decisions at young ages about the body they want for life. Sally Lockwood, Sky News.